Hello, I'm Charles Haskell, medical oncologist, ethicist, and photographer. Welcome to my vlog where I tell life stories that have taught me lessons. Today's topic is balancing, defined as the process of making choices based on weighing values and goals and letting go of those that are no longer relevant. My wife and I are the elders of our family. All of our grandparents, our parents, uncles, and aunts have died. We each have living brothers and cousins, but we have experienced the deaths of multiple family members. As a medical oncologist, I have also been involved with death and dying throughout my career. I've not been to war, so I've not seen violent death, but I've seen most other forms of dying. My mother's father, Dr. Charles Curtis Renfro, went to medical school in Chicago, and he died in the winter of my first year in medical school. He had been wounded in World War I and had vascular injuries, and ultimately died of a ruptured abdominal aortic aneurysm. He was very important to me, as shown by 2 episodes of my vlog in which I discuss his equanimity under fire with the fishing lure in the neck incident and how I learned responsibility in the Grand Canyon. The dilemma posed by his death was how best to honor him. Should I go to his funeral or not? I really wanted to go, but I knew that he would not want me to go if I had been able to ask him, because I was in the middle of medical school exams for the first semester. He would have wanted me to stay, study, and pass. So I stayed in San Francisco, took my exams, and did not attend his funeral. Christine was born in Switzerland and had beloved family in that country. My father-in-law, Helmut Wursten, wanted me to connect with them, so he paid for my little family to go to Switzerland in 1962. We returned periodically thereafter, including 1968. While there, we observed that her grandfather, Arnold Wursten, was having more and more difficulty making his daily walk from his home down to the village and back. And then one day, he did not make that trip. We learned that he had suffered a severe stroke and was paralyzed. Christine's grandmother, in consultation with the family doctor, decided he should not go to hospital, but that he should be allowed to die quietly at home. I was not involved in that decision, but I was very involved in caring for him during his final illness. I became the nighttime family member, staying in his room to help keep him comfortable. He was allowed to die without any medical intervention. No IVs, no artificial life support, nothing. And given his family's values, I was okay with that. The standard approach to medical decision-making involves doing a history and physical examination, reviewing all the laboratory results, making a diagnosis, and then choosing a plan of treatment. Over the years, I developed an approach to treatment planning that involved balancing 3 potential goals in the context of the person's social situation and legal restraints. The 3 essential considerations were the effect of various treatment choices on 1, survival duration, 2, the quality of life, and 3, avoiding harm, which is in the Hippocratic Oath as first do no harm. Thus, if survival duration was paramount, with cure being the goal of treatment, one might consider radical surgery or a bone marrow transplant for cancer. These treatments could potentially result in death. If quality of life was paramount, one might choose a palliative approach, such as hospice care. In a hospice setting, one might use morphine to control pain. However, one can't use morphine without the risk of respiratory depression and even death. so the dose would have to be carefully chosen to avoid causing the harm of premature death. However, if the pain were severe enough, one might choose to ignore the risk of early death to provide adequate pain control. In my view, the key question here is intent. I never chose to end life with morphine, but I undoubtedly did so on occasion in the course of relieving pain. Thus, the goals of treatment involve balancing, prolonging life, improving its quality, and avoiding harm. I think that mastering the tool of balancing is the essence of wisdom. Thank you for watching today. This concludes my stories about balancing. I hope you'll watch my next episode. Goodbye.